All right. Well, hey, everybody. Thanks for joining us for a brief few minutes of Climate Medicine Q&A. I'm Dr. Terry O'Connor with the University of Colorado Climate and Health Program. And today I'm joined by Dr. Edward Maibach. Some of you may know Ed as one of the world's experts in the uses of strategic communication to address climate change and its related public health challenges. And Ed, I'm really thankful to know you as a colleague and collaborator from the Medical Society Consortium on Climate and Health. And I'm sure that you're super thrilled to be joining us with our first cohort of the Diploma in Climate Medicine this fall. Fall colors, Rocky Mountain National Park. Are you excited?
On every level, yes, absolutely. Not only to be there with you this fall, but just the fact that you're launching this diploma program, it is so greatly needed, and it's high time that somebody made it happen. I'm glad it's you all.
Well, thanks. Yeah, and actually, that's perfect. I wanted to step back a bit and talk about where we came from and designing this program many months ago. I mean, much as your work with the Yale program on climate change communication has shown, is there's been a real dramatic increase in public belief and concern about climate change and the health risks, of course. And certainly myself and other of my colleagues as clinicians have become very, very concerned too. But it's been, I think, up to this point, really hard for us to know what to do about it. And it continues to be, I think, a challenge when I speak to peers in my setting or what our role might be. And, I think when Jay Lemery and I first started talking to you about this many months ago, you were so excited about the program from its onset because you thought clinicians play such an important role in this space. And I'm wondering if you could expand on that, your opinion on why we're needed in this space.
Yeah, absolutely. So many people who are concerned about climate change, which is most Americans and probably most people around the world, when they think about what has to get done, it seems overwhelming to them. It seems difficult and as if we're going to be deprived of many of the things we most love about our lives. But I'm convinced that nothing could be further from the truth if we, health professionals, if we do our job. And I'll tell you what I mean by that. We have a uniquely powerful voice as advocates for the kinds of public policies that will make it easier for the whole world to decarbonize. Decarbonization is the thing that we most need to do, and it has to happen worldwide. But it also has to happen in individual communities. To make it happen, we need good policies. To get good policies, we need strong advocacy. There are no more trusted voices in the country and around the world than health professionals. Survey after survey proves it, that we have a uniquely privileged position in every community. We are still, despite the craziness of the COVID pandemic and how some members of the public have responded to us, we still are the most trusted members of every community. So we can use that trust to advocate for the kinds of policies that will make it easier for individuals as well as organizations and communities to do what needs to get done. A
Mm-hmm.
hospital system, for example, that it aims to decarbonize, it's going to be a whole lot easier for that hospital system to decarbonize if the community that they are a part of decarbonizes as well, right? Because
Yeah.
the big energy use, the big energy generation decisions aren't made by a hospital system. They're made by the Public Utility Commission in their state or in their portion of the state. So for individual health professionals to make it possible, individual health professionals have this unique opportunity to make decarbonization possible in their community, in their state, in our nation, and around the world. That's fundamentally what I see as the opportunity.
That's great. So we may be in this unique position. We may have a platform, as you say, and there might be strategy for us to help enact some of this policy from where we come. But certainly, we can learn to do better, right? I mean, this isn't our bread and butter as doctors and nurses. We're not trained in policy. And from your perspective and your expertise, like, what can we learn to do better, and what do you actually hope to teach us, like our candidates in this course, so that we can be more effective change agents in this space?
Yeah, one of the things that's holding us back, frankly, is jargon.
Mm.
When, as health professionals, when we interact with each other, we are taught a form of jargon that's a very efficient way for us to talk to each other quickly,
Yeah.
effectively, clearly. But
Right.
when we talk to patients, we have to use a different language, right? A different
Yeah.
set of ways of communicating complicated information. I contend that health professionals have a unique opportunity to get the many stakeholders who have to participate in these policy decisions speaking in a common language, plain, in the case of those of us in the US, plain English.
Yeah.
So I like to say that the people who are on board with rolling up their understanding that we have a problem and rolling up their sleeves and trying to help bring about solutions, they understand five key truths. They understand that climate change is real, that it's human caused, that there's widespread expert agreement. There really are no climate experts anymore who aren't convinced, based on the evidence, that human caused climate change is a reality. The fourth thing is that people have to understand that it's bad. It's bad not only for plants, penguins, and polar bears, things that most of us tend to appreciate, but aren't central to our lives. But it's bad for our health, bad for the health of our children, of the health of our father-in-laws who are, already suffering from chronic illness and are particularly vulnerable to the health effects of climate change. And
Yeah.
finally, people need to understand that there's hope. There are actions that we can take that will make a profound difference. And those five key truths about climate change, I don't know a single health professional who wants to help bring about solutions who can't keep the conversation coming back to those five key points and and calling the question, all right, what are we going to do? What are the actions that we can take to make sure that human health and well-being do not needlessly suffer as a result of our changing climate? So
Yeah.
I would contend that we have not only a critical role in convincing the public and policymakers about the need to take action, but we also have a critical opportunity to bring together diverse stakeholders and have the kinds of adult conversations, non political, non polarized conversations that we need to have to make good decisions for our community, our state, and our nation.
Yeah. Well, you truly are a communication Jedi because you just stole my thunder on this concept of hope. But I wanted to finish up with you about something else, and that is, uh, you know, part I think what paralyzes us as healthcare providers is we're seeing the health impacts, and it's just hard to feel like there's any way we can have agency or impact some meaningful action in such a huge problem. But I think back to the COVID-19 pandemic, as you mentioned, that just showing up to work actually does give a sense of agency. And you're starting to lean in and work with more healthcare providers now. Are you starting to get a sense and perception that there is developing hope within, my colleagues in the healthcare community as we're starting to really start to dive into this space?
Oh heavens, yes!
Yeah.
This is the world's biggest public health threat. It's the big. I'm now in my well into my fourth decade, or I guess my fifth decade. I've completed my fourth decade, so I'm now launching into my fifth decade in the field of public health. I've worked on some really important public health crises early in my career. The HIV epidemic, for example,
Mhm.
in the 1990s, the start of the anti-vax, starting to try to fight and snuff out the anti-vax sentiment out there. Unfortunately, we didn't do particularly well there. But the point I'd like to make is I'm convinced that this really is the public health challenge of all of our lifetimes. And fortunately, a growing number of health professionals, they understand that. We've surveyed lots of different groups of health professionals, and we see that the overwhelming majority of them intuitively
Mhm.
understand that this is the public health challenge of our lifetimes. Most of them tell us we don't know a lot about it, but we want to learn more, which is exactly why I think the diploma program is so
Yeah.
exciting. But this is also the public health opportunity of our lifetimes, and I'll tell you why. The the actions that have to happen in order for us to keep our climate in the safe zone, those actions will have climatic benefits, climate change benefits decades to come, but they will also have profound human health and well-being benefits immediately. And in the communities that take the actions. So when my community completes its current efforts to decarbonize Montgomery County, Maryland, we've got we are rapidly making progress, and we are the primary beneficiaries of it right here, right now in Montgomery County, Maryland, and that fundamentally solves the conundrum that people don't like to make investments that don't pay off for many decades in the future. So when climate scientists are talking about climate solutions, they are offering benefits that pay off 30, 50, 100 years from now. When health professionals talk about health climate solutions, they also are talking about health and human well-being solutions that pay benefits immediately and locally. So we really do hold the solution to that conundrum, the fundamental conundrum of behavioral economics, that people don't like to make and to pay for things today that won't benefit them until well down the road.
Right, right. It really is an amazing opportunity, and I'm really looking forward to the opportunity to work with you more in this coming year. And I'm happy to extend the opportunity to anybody else who's still interested to lean in and join Ed and myself and the rest of our colleagues and faculty with the diploma program this fall and into the years ahead. Ed, thanks so much for your time. Really appreciate it.
Thank you, Terry. Look forward to seeing you soon.
Yeah.